My name is Jodie Norris, and I will be discussing the pathophysiology of rheumatoid arthritis and the body systems that are affected and how they are affected, and common signs and symptoms of rheumatoid arthritis, and some ways to diagnose and the prognosis of rheumatoid arthritis. The body systems that are affected is joint tissue. The joint tissue is affected by rheumatoid arthritis. The first tissue to be affected is the synovial membrane. The synovial membrane lines the joint cavities. Once the synovial membrane is affected, the inflammation may then affect the articular cartilage, fibrous joint capsule, ligaments, and tendons. There are joints that are affected more than others. These joints are in the fingers, feet, wrists, elbows, ankles, and knees. There are some other joints that are affected that's not as common. These include the shoulders, hips, and cervical spine. And the lungs, tissues of the lungs, heart, and kidneys, and skin may also be affected. How does RA affect the body? According to our Understanding Pathophysiology textbook, during inflammation, arginine, which is an amino acid, is broken down by enzymes into a different amino acid, which is citrulline. Citrullination, is a process that changes the structure and function of proteins. Two examples of proteins that become citrulinated during this cell death and tissue inflammation are fibrin and vimentin. These proteins are then looked as S antigens by the body's immune system. The textbook also states that T and B cells play a role in the autoimmune response. The T cell activates a nuclear factor that fosters the formation of osteoclasts and causes bony erosion. There are three processes that is the cause of cartilage damage in regards to RA. The first one is neutrophils and other cells in the synovial fluid become activated, which degrades the surface layer of articular cartilage. Several inflammatory cytokines induce enzymatic breakdown of cartilage and bone. Third, T cells interact with synovial fibroblasts through TNF-A, making synovium a thick, abnormal layer of granulation tissue called pannus. Pannus is composed of macrophages, activates the release of IL-1 platelet-derived growth factor and fibronectin. B lymphocytes are fused to produce more rheumatoid factors, which are just antibodies that are changed. These self-antigens are in steady supply and can sustain inflammation and the formation of immune complexes. This is still how RA affects the body. The synovial membrane has damaging effects caused by inflammatory and immune processes. Leukocytes penetrate the synovial membrane, which causes swelling. The synovial membrane also undergoes hyperplastic thickening due to cells proliferating and getting abnormally large. According to the Understanding Pathophysiology text, synovial inflammation progresses to involve its blood vessels, small venules, become occluded by hypertrophied endothelial cells, fibrin, platelets, and inflammatory cells. These decrease vascular flow to the synovial tissues. Metabolic acidosis, along with hypoxia, is a result of compromised circulation and increased metabolic needs. The Understanding Pathophysiology textbook states that acidosis stimulates the release of hydrolytic enzymes from synovial cells into the surrounding tissue. This causes the erosion of the articular cartilage and inflammation in the supporting ligaments and joints. The formation of pannus, which happens after all the above occurs, leads to the evolution of scar tissue that immobilizes the joints. Some common signs and symptoms of RA: tender, warm, swollen joints, morning stiffness that may last for hours, firm lumps of tissue under the skin, especially on the arms, fatigue, fever, weight loss, and pain, which is caused by pressure from swelling. How is RA diagnosed? RA may be difficult to diagnose in the early stages because it mimics many other diseases. Another way is the physician will perform a physical exam where he or she will check the joints for redness, swelling, and warmth. The joints will also be checked for muscle strength and reflexes. X-rays can be used, but are often just only used to kind of keep up with the progression of the disease process. There are several types of blood tests to diagnose RA. These tests include anti-nuclear antibody tests, C-reactive protein tests, erythrocyte sedimentation rate tests, and also during diagnosis, usually individuals that have RA will have an elevated ESR, which indicates the presence of an inflammatory process in the body. The typical outcome for someone with RA. RA does not have a cure. The disease is progressive and eventually leads to severe debility. The main outcomes are ongoing and persistent joint inflammation, progressive joint damage, and progressive decline in joint movement and functionality. The outcomes also affect other systems due to the disease being a systemic disease. Does RA require short-term or long-term care? RA requires long-term care due to this disease being a progressive disease. The long-term care includes ways to treat and control the pain and inflammation. The impact of daily life and ADL performance with RA. RA makes it difficult to perform normal ADLs due to the pain and joint stiffness that occurs in the mornings. The morning ADLs may have to be performed later in the day because this gives the joints time to kind of warm up and get prepared to do what they need to do. RA also progressively gets worse over time, making it more difficult to perform the ADLs. This concludes my section on RA. Next is Sharon Hicks.
I'm Sharon Hicks, and I'm going to be going over the next couple of slides, which are some of the ones Jodie have already went over with ways to diagnose RA, the lifespans, daily activities, daily living activities, activities of daily livings, some support sources, as well as financial assistance. Diagnosing rheumatoid arthritis. There is a specific test for rheumatoid arthritis, which is an anti-CCP antibody test. Other tests include complete blood count, C-reactive protein, erythrocyte sedimentation rate, joint ultrasound or MRI, joint x-rays, or the rheumatoid factor test. Lifespan. The life-shortening effects of RA varies. Most sources cite a lifespan reduction of 5 to 10 years. Daily living activities. During daily living activity, the daily living activities are impaired. People with rheumatoid arthritis are unable to do simple daily living tasks such as washing, dressing, and eating. After 5 years of the disease, approximately 50% of sufferers have substantial functional disability. Ethical issues, that are included: placebo-controlled studies, and the capacity of such patients to accept or deny treatment. Impact of RA on the individual, family, and society. The individual, RA affects people differently according to the severity of the disease. Relationships with families and friends are often affected, usually because the person with RA is no longer able to participate in all the activities that they had previously. Most people with RA experience difficulty with physical contact in two main areas. Social contact, most common, shaking hands and being in crowds, and more intimate, hugging and lovemaking. Some of the financial assistance that was listed include Affordable Care Act, Needy Meds, Health Well, state programs, Medicare or Medicaid, and private insurances. Support groups include Arthritis Foundation, Daily Strength, Healthline, and MD Junction. Pregnancy in RA. Rheumatoid arthritis often improves during pregnancy, but unfortunately it is not usually sustained after delivery. And that concludes our portion of the PowerPoint.